In Guyana, where malaria remains a persistent threat, the effort to overcome the disease extends beyond clinics. It's driven by collaboration. At the heart of this effort, Breakthrough Action is working hand in hand with teams, building the systems and skills needed to ensure malaria, social, and behavioral change efforts endure beyond the project. To strengthen this framework, the Memorandum of Cooperation was established.
When you hear she buzzing, big problems coming, big problems coming, big problems coming. Look this way, mosquito, big problems.
So the Memorandum of Cooperation, it's a concise document that really outlines the collaborative effort between 5 government and private sector organizations to combat or reduce the spread of malaria or the impact of malaria in the endemic regions in particular. And these 5 organizations that signed the Memorandum of Cooperation in April 2024 were the Ministry of Health, the Ministry of Labor, the Guyana Geology and Mines Commission, the Guyana Gold and Diamond Miners Association, and the Guyana Women Miners Organization. So the Memorandum of Cooperation is extremely important, and it was a timely document because the Ministry of Health recognized that it needed the public-private sector support to be able to work collaboratively to reduce the impact of malaria.
Based on the Ministry of Health data, they would have seen that there was a correlation between mining activities and malaria infection. Now, given that GGMC has a presence in these areas, we understand the logistics, we understand the concentration of the mining operations. It was determined that we would be a good stakeholder in terms of helping the effort towards eradicating malaria infection.
Malaria disproportionately affects miners and nearby remote communities, where limited access to healthcare and prevention tools has allowed the disease to persist. This partnership is changing that, though it has faced significant challenges.
So the association is committed to working with all other partners, as I previously mentioned, the Ministry of Health, Labor, the Women Miners Organization, and GGMC to accelerate all interventions to have malaria reduced firstly and subsequently eliminated in Guyana by 2030, which, as I mentioned, is a goal of the Ministry of Health. We have been able to build relations with the Vector Control Services and the National Malaria Program at the Ministry of Health for the betterment of our miners. And this relationship continues to strengthen, and we are in close contact with the 2 agencies at the ministry.
The MOC establishes a strong alliance among the Ministry of Health organizations. Through this collaboration, these partners integrate social and behavioral change tools into their approaches. This not only boosts their ability to combat malaria, but also ensures that their interventions connect with the communities they serve.
So for me, SBC is more of a form of a targeted intervention and communication, advocating more at not just at the policy level, but at the community and a local level as well. SBC brings about more where you have communication between the health aspect of it and between the locality level of it. Therefore, having persons be more involved in the process than just being an recipient of what we're doing. So for me, that is what they've brought to the table thus far.
So SBCC, I think it's about listening. First of all, you listen, you have to observe, you have to work with the community, in the community at times, to understand their experiences and to try and build ways for them to change how they are in the community and to improve on any health issues that they have.
Capacity strengthening sessions have equipped national teams to integrate SBC into every aspect of their work and bridged departments that once operated in isolation.
I think that Breakthrough Action supported the vector control program to reach those populations that were very hard to reach with services that are tailored to their needs. But not only services, also training and learning and promotion and peer education and all the new approaches that Breakthrough Action was able to test in the field with the Ministry of Health and always supporting them and also seeing the results.
With the tools and skills gained through Breakthrough Action's support, these teams are well equipped to continue the fight against malaria, strengthening health systems and leaving behind a legacy to model.
I said this little mosquito, big problems coming. Look, this little mosquito, big problems coming.